the vulva, which is all your labia, everything from basically the pubic bone, where you have the mons pubis, the little nice cushion area on top of your pubic bone, all the way back past the vagina, the urethra, then you have the perineum. So even the vulva, the lips, the labia, and even the pelvic floor is really considered like the vaginal area. When I say vagina, I'm really talking about the vaginal area. And so estrogen is so important for all those tissues. So your vagina, elasticity and the ability for it to stretch. Like we all know when we have babies, the vagina has to stretch. When we have sex, the vagina has to stretch. But even when we walk, our anatomy is such that if you're doing yoga, that vagina's got to stretch. And if we are losing our elasticity, then that's going to cause some tearing, some irritation, start to feel uncomfortable. And as women hit perimenopause, sometimes vaginal symptoms, vulval symptoms are the first thing that happen. Sometimes it's not. Sometimes they have trouble sleeping, they get their hot flashes, and they can even go 5-6 years, they get through it and they're like, oh, I got through menopause. And then they get the vaginal symptoms. And so it can occur at any time. It's really unique to everybody. But if we lose estrogen, if we're old enough, if we live long enough as a woman to go through that menopause transition, you're going to lose estrogen. Estrogen, it's going to affect the vagina, the urethra, the pelvic floor, the bladder. It's going to affect all those tissues because those tissues are so dependent on they have so many receptors for estrogen. And so we see a lot of things like itching, burning. We see pain with urination. We see pain with intercourse. We see increased urinary tract infections. Even a lot of women will come to me and they'll actually tell me like they're uncomfortable even putting their clothes on, like their underwear is uncomfortable. They're stopped wearing pants altogether. Forget riding a bike. Like if you have girlfriends and they're like, I am not taking that spin class. A lot of times it's because of the discomfort down there, and it can be uncomfortable just to sit. And there's a lot of solutions, one of them being estrogen, because estrogen is so supportive. Unfortunately, it's not talked about very much. A lot of doctors don't even understand the physiology and the importance of estrogen for the restoration of those tissues. And there's a big stigma about estrogen from the Women's Health Study about oral estrogen, which it does not cause the things that they said it caused. There's been meta-analysis afterwards, but the cool thing about vaginal estrogen is that it's very low doses needed, like a micro dose is needed. What a woman takes orally for a standard dose, you're going to use like 1/100th of that vaginally. So it's so low dose, but it's so effective. And when used topically, vaginally on the vulva in that whole area, it stays very local to the vaginal tissue. So it's not going to go into the bloodstream, meaning it's not going to go systemic. It doesn't cause any risk, even for women who have had history of breast cancer. And their oncologists agree, the North American Menopause Society agrees. So it's well documented. And it's really a well established and agreed upon area among medicine. However, unfortunately, a lot of women, their primary care doctor did not get the memo, and they just read estrogen is bad for you. And so a lot of women are not getting what they need, and it's so easy to do. There's many, many ways you can do vaginal estrogen. There are little applicators that insert a little teeny tiny pellet of estrogen. So that's really easy for women to do. There's creams and serums that you can use. And then there's also the E-string, which is like a little ring that's really flexible, and you can just insert like a tampon, and that actually stays for about 3 months. You can have sex with it on, you can go about your normal day. And I think that is great for women who might have dementia or have trouble remembering things, or if you just can't get your crap together, you just can't remember to take your estrogen. It can be so important. And I actually had a client who was referred to me, and it was actually the aunt of one of my clients, and she does have a home care situation where she's not able to take care of herself, but she was getting recurrent urinary tract infections. And one of the benefits of vaginal estrogen is that it helps not only to keep the area protected with the skin's protective barrier, because the cells actually need that estrogen, but the estrogen also supports the growth of lactobacillus, which is really important for the microbial balance the microbiome of the vagina and the urinary tract. And so having that vaginal estrogen really helped her not get those urinary tract infections, but her caregiver forgot about her estrin, forgot to give her her 3-month estrin, and she started getting urinary tract infections. And she's elderly, so they actually got bad because her skin was very damaged, and she had to go to the hospital. She had almost had kidney failure, and she had risk for sepsis because of, when you have a urinary tract infection, you go to the doctor, you get an antibiotic, and the reason why they're giving you the antibiotic is to get rid of the infection. And infections are dangerous just in general. If they're left untreated, they can leak into the blood, and that's called sepsis. And so the point of my story is that the vaginal estrogen could have been life-saving for her. So she, once they figured out what was going on, they gave her the vaginal estrogen. She did have to go through a course of antibiotics, and she's fine now. But vaginal estrogen can actually save a life. I know that was like a long story here, but there's so many. I mean, everything from sexual dysfunction, painful sex. A lot of women come to me and they're like, my husband's going to leave me. I'm attracted to him. I want to have sex, but it's either not comfortable because no lubrication. Estrogen helps with that. Or it's not comfortable because there's no elasticity. There's tearing. There's pain. And then there's the other end of the spectrum. I feel nothing, where the nerve endings are actually starting to atrophy a little bit, just like the cellular walls are starting to atrophy. And estrogen can help with that too. I know it sounds like magical, and it really is, because for women and for our whole vaginal pelvic area, it's so magical and it's so underutilized.
It's funny. I was thinking back with my patients over the years, like you hit the nail on the head earlier when you're like, we use all this stuff on our face. We're putting stuff all on like I put on layers of stuff on my face. But I would have patients that'd be like, oh, I don't want to use a cream down there, or I don't want to use something down there. Well,
I understand, like, you don't want like to have discharge, you don't want it leaking out, but there's so much advances in technology where it's not going to be like you've got this mess going on. We actually just released an over-the-counter product. We call it Glow Below, and we say it's skin down there, but it does have micronized estrogen in it. And that it's available over the counter, but it's like serum. So it absorbs quickly, but it stays moisturized. And so, like I said, there's the pellets. You're not even gonna feel those, not pellets like you insert, not that kind of pellet, but I forgot what it's called, Vagifem. I think it's the brand name.
And then Imvexy is another one that makes like a little ovule.
Yeah, they're little tiny. You don't feel them at all, and there's nothing's gonna come out in your underwear. It's such a small. What you need is so tiny and so small that you're not going to know it. And about 1/5 of women who are on hormone replacement therapy, so it's different than hormone replacement therapy. So most women, as they go through menopause, have other symptoms as well. I'm a big proponent of, if you want to replace your hormones, you should definitely have that opportunity. And there's so many benefits to heart risk goes down, osteoporosis risk goes down, Alzheimer's risk goes down, longevity goes up. And of course, you can have mood improvements, body composition improvements, hair, skin, nails, all of that. So if you're on estrogen and or progesterone, testosterone, if you're on a hormone replacement therapy, that goes systemic. So that can help your vaginal health. And for, I would say, 80% of the women, that's probably all they need, but there's about 20% that need that additional vaginal estrogen. And I think that all women can benefit from a vaginal moisturizer. So to me, if you're gonna do the vaginal moisturizer, you might as well have a little bit of estrogen in there too, because again, using like the Imvexy or Vagifem or the E-string, that's just estrogen. So that's not giving you the moisturizing quality like what you're doing on your skin or under your eyes or your lips. Think about your lips. Like we have lips down there too, but you have to like put like chapstick or some kind of balm or some type of moisture. Otherwise they're going to crack and get brittle and they hurt, right? There's pain involved when skin gets dry and cracked and brittle and it loses its protective barrier. So of course, down there, we got to take care of it. We really do. And taking care of your vaginal area, your vulval area, you have to be careful because there's a lot of products out there that are marketed for down there, but they should never be put down there. There's a lot of chemicals, a lot of perfumes, anything that tries to make you smell like a flower. Run the other way. Our vaginas are supposed to smell like vaginas, not like flowers. I mean, you should have your smell. And one of the symptoms of loss of estrogen can be a change in the odor or the color. So if you start